Are you going to be talking to me? Me? Okay. Welcome to the Doc Talk Tuesday at Prime Sports Med. This is Jacob Bauer, and we're just going to be talking a little bit today about a couple things. We're really excited. On Monday, we're going to be going into the Caldwell Clinic for the first time. So we're really excited about finally having a large, awesome clinic with a bunch of private rooms and a big physical therapy layout area. It's really nice. If you haven't seen it, if you haven't seen it, go check out our Facebook or Instagram. There's some pictures of it on there. And as we get treating patients, we'll share some pictures on the inside too. But we're really excited about it. It's off 10th and Linden, over by Wilson. It's fairly close to the hospital. It's only about a mile, 1.2 miles from the old office. So if you just follow 10th, it will curve around, headed south. It's just right off 10th, over by the orthodontist place. There's a Burnt Lemon over by McKim and that large, kind of like that shopping or that little place right across the street from Wilson. But anyway, today we're going to be talking about a few different things with there's a lot of people get confused when they come in about, all right, when should I come see you guys, or when should I go to the orthopedic surgeon, or when should I go to the primary care doctor? And so that's most average people don't really know exactly when and how and what, and a lot of times it's a little bit confusing. But I just want to explain a situation I saw yesterday. We had a patient, not yesterday, last week. We had a patient that sprained an ankle really, really bad. They got all puffy, and they had a pretty difficult situation because they tried to get into their orthopedic surgeon. They couldn't get in for weeks, and it was just swollen. They went to the primary. The primary referred them to that same orthopedic surgeon. And they were just kind of frustrated with the situation. They ended up coming to see us, and I kind of explained to them, like, listen, if you have something really, really sprained, really bad, and you're just worried about it, you can always call us, get in, usually same day or next day or day after, a much shorter period than getting in with the doctor sometimes, and we can evaluate it. And Jared Simonson, our physical therapist, he worked at the College of Idaho for years treating college athletes. I mean, he treats sprained ankles as good as anyone. And so if you would have called us, got in and seen Jared right away, he would evaluate it. He might have been able to evaluate it and said, hey, nothing's really torn. It's just sprained. You can just do rehab here and be fine. Or he would have evaluated like, yeah, this is really bad. You need to go to the orthopedic surgeon. So we're not anti-orthopedic surgeons or anti-primary docs by any means here, but sometimes it's best to just call us and come in. A lot of times, even the doctors, me and Dr. Field, a lot of times we'll do free evaluations to kind of just tell you what you need to do, whether it be just see us, we'll refer you to physical therapy, no, you really need to go see the orthopedic surgeon, or no, we really need to get imaging because you probably have a fracture, or sometimes MRI when we know for a fact that it's something that only MRI can show. So there's a lot of different situations out there. It can be really, really confusing. Don't forget about us. You can always come see us very fast, and we can a lot of times figure something out and get the treatment started right away. Early treatment is huge, especially when it comes to sprained ankles and or anything that's really acute. A lot of times when it takes a few weeks to get into orthopedic surgeon, it's best to come see us and get early treatment, whether it be, some of the mobility stuff that we do, some of the laser stuff we do. A lot of the treatments we do has been proven by evidence-based studies that we remove inflammation and we provide quicker injury durations, and we can fix people at a much faster time. The sprained ankle is one of them. We do something called Grafton treatment, where we take tools and we actually scrape out some of the inflammation really lightly. We do flossing, where we would wrap the ankle in a floss band and get it moving We do very specific rehab exercises that wouldn't re-hurt the injury based on what we think's going on. Some of the injuries are very, very common. A lot of times it's just going to be the typical talofibular sprain strain when it comes to the ankle. Other times it's going to be other more complicated injuries, and with those injuries you don't want to do specific exercises, or you don't want to do soft tissue work on them. You just need to let it rest and get to the orthopedic surgeon as soon as possible. So there's a lot of different things that go on, but a lot of times seeing us first can save you some money, can save you a trip to the doctor, and or sometimes you just want to be confirmed, like, yeah, I need to go get this checked out, or yeah, I really need to get imaging. And we do all that here at Prime Sports Med.
How did the doctors determine whether or not imaging is needed?
So we, whether it be Dr. Simonson or Dr. Physical Therapy, Dr. Field, or myself, we follow guidelines too. We went to school and we a lot of times we follow specific guidelines on specific injuries. So there's guidelines for ankles, shoulders, even low backs, and a lot of times it's just they have a certain amount of things going on. We automatically refer out. For example, with the ankle, there's a few different things. If they can't bear weight on it, if it's the malleolus, if it's tender to the touch, it's a specific bone on the side, and swelling, and there's a few more different criteria, then we automatically, hey, we need to get that. We need to see if that's fractured. When it comes to the knee, if we're testing ACL, PCL, or some of the lateral and medial ligaments, and those are positive, and we do a couple orthopedic tests, and those are positive as well. And then there's some sort of functional things going on that are positive too, then we would refer that knee to get an MRI, because we're fairly confident that there's a some sort of ligament tear at that point.
What's the difference between an X-ray and an MRI?
That's a good question. I know and that's kind of, we're in the medical field, so it's just kind of what we do, and we understand it really well. But a lot of people think you can get an X-ray for your low back when it's pain going down your leg. So X-ray is only going to show bones. It's not going to show ligaments. It's not going to show discs. Now, an X-ray will sometimes give you some clues about what's going on. For example, if the bones are like the vertebrae are really condensed on the X-ray, then you know that there's degenerate disc disease going on, but you don't necessarily know that there's a disc bulge or a disc herniation going on. But you know there's degeneration based on the bones that you see. But there's a lot of different things that can go on an X-ray, and I would say we X-ray more than your typical. When I say typical, we don't X-ray as much as like a typical chiropractic clinic. A lot of chiropractic clinics X-ray every single patient comes in the door. So we don't do that at all. But when it comes to a severe injury, we tend to like to see imaging, especially with our athletes, especially our high-end athletes. It's just nice to have clarification for sure to know, okay, nothing's torn, or nothing's fractured. And then sometimes what an X-ray does is it's kind of just looking under the hood of a car. Some people have an extra vertebrae, some people have a deformity, some people have an abnormal curve, and so all that stuff helps us. So a lot of times we will send for an X-ray if we have a few treatments without anyone getting better. And then MRI obviously shows all the ligaments, discs, all the soft tissue stuff, and we do a lot of MRIs as well.
There's a lot of chiropractors that offer X-ray in office. Why do we not? Why don't we offer them in office?
So the typical old school chiropractic way is to X-ray, for example, the low back, identify misalignments, and fix those alignments based on the adjustments. My belief is that those misalignments, not a whole lot of evidence that you can fix a misalignment off an adjustment. I believe in fixation. So I believe that joint spaces, and this is not just me, this is Dr. Field and a lot of our, I would say like our sports chiropractors have this common belief. We believe in fixations of joints and soft tissues. So a lot of times you can adjust, for example, a low back 100 times and nothing's going to really move based on the x-ray. And if you would x-ray it after, you would see the same result a lot of times. The only situation where that might not be true may be like a curve, like after an accident. Someone may have a really flat curve, and after a lot of adjustments, that curve may be restored. But talking about just like a joint being one way or the other, they really don't move a whole lot after an adjustment. But the adjustment still has a lot of benefit because it opens up the joint and restores that range of motion. So, for example, if the neck had limited range of motion and rotation, flexion, extension, lateral flexion, after an adjustment, science has shown, or evidence has shown, that neck actually moves better after adjustment. So the range of motion is restored a little bit. And if we use that adjustment with some soft tissue work, laser, physical therapy, other modalities, exercises, that's where then chiropractic is really effective. Oftentimes we get really fast results with chiropractic, especially me and Dr. Field. That's why we love our little method that we have, where we have everything in-house and we're seeing all sorts of injuries, and we have all these injuries divided out and organized, who's seeing what injury, who is being treated when we have this condition. A lot of times me and Dr. Field, someone will come in really, really hurting. We use advanced soft tissue techniques where we really get aggressive, make them scream or hurt, adjust them, and all of a sudden their pain is all gone. And that's awesome. And me and Dr. Field see that a lot. And then that doesn't happen all the time when the injury is a little bit more serious or a little bit more chronic, lasts for more than 2 weeks. But a lot of times we're kicking that off to physical therapy to get more rehab and results that way.
Perfect. I don't see any more questions. Is there anything else that you wanted to say?
Nope. Caldwell Clinic, our brand new office, will be open Monday. Call and get an appointment, or feel free, if you guys know us, you can stop by and check it out, say hi. And we'll be doing some videos of the new office. We'll probably be having a grand opening. I'd like it to be a little bit warmer before we have that grand opening in Caldwell, but that should be coming soon as well.
Have a wonderful day, everyone.